A lot of people are nervous when it comes to psychedelic assisted therapy or ketamine assisted therapy. So I really want to ask the question in this video and get it answered by professionals on, does ketamine get you high, if that's even the right word for it? So as usual, I am joined by Fraser Johnston. Fraser pioneered the Odyssey method, which is a structured and holistic approach to psychedelic assisted therapy. Fraser is also the CEO and founder of Entheomed, which is one of the world's leading clinics in psychedelic assisted therapy. So Fraser, can you answer this question? Does ketamine and ketamine assisted therapy get you high? And what is that feeling even like?
So the way I would describe this, Mark, is a non-ordinary state of consciousness. So ketamine therapy isn't about getting high. The goal is a controlled therapeutic experience, not intoxication.
Could you give us an example? If someone's never done psychedelics before, what would you describe that experience like?
So I think the key word here is like a change in perception or your normal awareness or your everyday thinking mind. So some people interpret that as the feeling of being high. So in the therapeutic context, we carefully dose the client and guide them through that experience. Because really, when you're in that non-ordinary state of consciousness, that's when you can access, different perceptions, have different emotions or different understandings of potential events in your life, emotions or thought patterns that you have regularly. But because you're in that non-ordinary state, you can access more of the subconscious mind of where some of these patterns potentially came from.
And what is that, where does that ketamine therapy exist in a recreational sense? Because I feel like when people see and hear the word high, they think of like, someone on the streets that, got high and is just like laying there. What is different with the Odyssey method?
So it's funny, Mark. I've never, in years of running the clinic, I've never once heard our therapy or medical team use the word high for it. So I think that's the thing, is creating that therapeutic container where the person can have that inward experience. They might feel calm or detached from their normal everyday thinking mind. So the experience definitely varies for a lot of people. Some people may describe it as high. So especially in the recreational setting, if people are, at festivals, partying with friends, or you are seeing drug use in the streets, that's very much a recreational context. And I would always say the experience will stay very surface level. Whereas when you're in a therapeutic setting with, medical professionals, that safe container is actually what's allowing a really deep personal experience where people can have a lot of benefit on the mental health side of it.
I think that's a great distinction. For myself personally, I have two young children, a toddler and a kind of old baby now. And I've also done some psychedelic assisted therapy too. I almost describe it as like the way my toddler sees the world. I almost feel like that's at least my own personal experience from using psychedelics. And it's definitely, I think you're right with like the way your doctors never describe it as getting high ever. I would never describe it as that either. It's definitely, I think the way you describe it is really accurate, like an altered state of your consciousness. So thank you very much for giving us a very detailed overview of that. If you're interested in ketamine or psychedelic assisted therapy and you want to potentially use the Odyssey method, then you can talk to your doctor and also use the link down below this video where you can get our discovery guide and even book a call with one of Fraser's doctors at the clinics to really learn more before you deep dive into doing some sort of psychedelic assisted therapy. And of course, subscribe to the Odyssey method with Fraser Johnston on YouTube, and we'll see you in the next video.